I'm just going to start recording.
Okay.
How are you?
Good. How are you?
I'm good.
What's new?
Oh, well, INACSL
I know. We're here.
2023.
Yep.
It's really beautiful out here in Rhode Island. That's where it is this year, Providence, Rhode Island.
Yes, it is in Providence, Rhode Island.
Beautiful out here.
I've never been here before.
Me neither.
Yep.
A fog rolled in yesterday, halfway through the conference, and then it started raining in the evening. When we were walking back to the hotel, it was wonderful.
Yeah, I'm not a big on rain.
I'm from the desert. We love rain.
Oh,
it's
that's
like,
true.
oh my gosh, water.
I forgot about that.
So, Deb Tauber,
Yep.
thank you for joining me on this impromptu immersive med pod here live at INACSL. It'll be recorded when we launch it, but thanks for sitting down.
It's an honor. Thank you.
If the audience doesn't know, if you watch the videos on the YouTube channel, you'll see a Sim Cafe coffee mug in my background on my bookshelf, because when I was on Deb's podcast, you mailed me a coffee mug and a shirt, which I wear, by the way.
Well, you were a guest, and I was very grateful because I learned a lot from you, especially about like ChatGPT. You're the one who really taught me how to do that, and I use it almost every day now. But I will tell people if I'm using it for something so that they don't think that I'm just coming up with information on my own. But I make sure that it's like I'll look through it and think, is this right? And then if it makes sense, it's a lot easier than just sometimes looking things up.
So tell people a little bit about who you are. What do you do? You're using ChatGPT, but you're not an accountant.
No. Right? No, I'm far from an accountant.
So tell us about Deb Tauber.
Okay, so Deb Tauber is a nurse. I've been a nurse for many, many, many years. And I worked in the emergency department for about 25 years. I was a clinical educator. I was involved in healthcare and in trauma when level trauma started. So when I first started, just the closest hospital would get the patient. So if you were whatever you were, mechanism of injury, you would go to that hospital. And then in the 80s, they did studies in California where they had designated trauma centers, and they would get people to the designated trauma centers within the hour. And so I had the opportunity of working at a hospital where we started out as level 3, and then we went up to level 2, and then we were designated with level 1. So I learned about process, and it was an evolution of that at that time of trauma care and the golden hour and different things there. So it was really exciting, and it was a lot of fun. Very similar to what is happening in simulation now as we evolve from, high fidelity mannequins to virtual reality to augmented reality. So after I did that in emergency department, I did some work in assisted living nursing home, and I found a special passion for that, because when patients went to the emergency department, they always thought that everything was going to be okay, that we'd be able to fix them. But unfortunately, sometimes we couldn't. And when I worked in the nursing home, I had the opportunity to help families learn about end of life and dealing with end of life issues and helping them usher their family and loved ones to the end. And so it was a really good learning curve for me. And then I got into education, where I found kind of a new chapter, and I found out about simulation.
There you go. So I was just going to ask you, for those who may not understand, why is simulation so important to clinical education?
It is really important to clinical education, because working as a clinical educator in a level 1 trauma center, we used simulation to a certain extent, but not the way that you can use it now. And there were times when I believe that if we would have used simulation for hiring decisions, we would have made better decisions, because you are able to learn who really understands how to prioritize, how to delegate, how to use their use of inflection of their language.
Wow. That's so interesting with the staffing shortage. I mean, hospitals don't really have a choice. They're scrounging for staff. Can you imagine them vetting people through a simulation to come work in the hospital? I don't know if they have that luxury anymore. Because you know that the thing that's close to my heart is the World Health Organization. We have a shortfall of nurses coming in 7 years of 15 million. And so that's the root of why I asked you why simulation was important, because I don't see us getting there to a solution without simulating the education required to bring a healthcare professional to clinical competency.
And I think your response would be virtual reality is
One tool.
one tool.
Yeah.
One tool.
One tool.
Right. Right. And you can, and this would be a conversation, right, between you and I, like how much would a gamer be able to influence the system using virtual reality?
That's really interesting that you brought that up. So we were letting people play around in virtual reality, and the way that, for example, VR Patients is set up, you have to be a clinical professional. You will not know what to do. Like, there's no tricks. For example, it always bothers me when I see an immersive solution, like a clinical training solution, and you're supposed to assess the patient. And so there's some menus, and it's time to assess. So you click on assess, and you pull out your stethoscope, and then like these blue circles show up on the patient to tell you where to listen. And which I thought to myself, that's a little too gamified for me. I don't get blue circles in real life.
No.
And if I do see blue circles on the patient's chest, we have a whole different problem there probably, right?
Yeah, for sure.
So,
Especially blue circles around their mouth.
yeah. Anything blue in skin is probably not good. Anyways, you bring up a really interesting thing, which is we've been doing simulation the same way for a while. Like, it's been a good stint of mannequin simulation, and what do the play actors call it? Standardized patients, where people pretend to be, which are so fun and so valuable and so helpful. Not scalable, though, right? That's a one-to-one relationship. You can't do 10,000 people doing play acting, all these different people, patients, for the purposes of educating one student. It just wouldn't work. But you can do that with an immersive solution or a digital solution, right? You can give one student 10,000 immersive simulations, and they will respond and act accordingly. But for that day where they need to do, and we have talked about this before, a debrief where you need to speak about it. You need to talk about what went wrong, what went right, what went poorly in the moment, and you want it to be so real that they were sweating, shaking, nervous. I mean, you really need another human being
Right.
for that. So what do you think about this direction? What do you think of the direction of simulation today? Are you excited about it? Or are you
Yeah, it's really exciting. I mean, if you even think about, if you're here at the conference, you're going to absolutely know that we have pet therapy. There are actually live puppies here.
I went over and pet the puppies.
I know.
They're so cute.
And it was such a great idea. And I mean, if you think about how things are evolving and how much pet therapy has become a regular part of our world. So these people were thought outside of the box enough to say, hey, you know what, let's bring these live animals here and let's go ahead and see if we can find a home for them. And why shouldn't what nursing conference?
They're up for adoption?
Yes.
I didn't know that. Oh, man. I wish you hadn't have told me that.
What nursing conference is not going to find a home for some puppies?
Yeah, those puppies are going to get adopted for sure.
I'll send you a picture of me and one of them.
Okay.
I asked if I could bring it home. My family said, is that a simulated puppy?
It's a really good one.
But of course you can.
All right, so last question.
Yep.
I want to ask you about any fears or concerns you have about the direction that simulation is going. Because I have some fears and concerns about poor simulation, poor virtual digital simulation. that could produce not a clinically competent person. But those are my concerns.
Well, and I think you hit on something that really is important, and that is, how are we utilizing virtual reality, and how are we using it, and who's kind of the gatekeepers, and do we have any gatekeepers?
Yeah.
I think if you think about...
Whose responsibility is that? Who should be the gatekeeper?
Well, I think if you think about the Society for Simulation in Healthcare, we've got a lot of policies and procedures around simulation, and I think that that's going to have to become more robust. And I mean, even some simple things about virtual reality and safety. When you get into the headset, you're risking you could fall down. You could have a psychologically unsafe experience in your mind, and how do you let someone know that? So I think that there's a lot. There's gonna be a lot to be thinking about.
Well, Deb Tauber. By the way, is it Deborah? Or
Yep.
is it just, it is?
It's Deborah, but I just changed it to Deb.
You did? I never knew that. Deb. Mine's just Devin. It's
Yeah, I know. We already went over the origins of your name.
Thank you. Thank you for sitting with me and chatting, and happy simulating, as you say on the Sim Cafe podcast.
Thank you.
By the way,
Thank you so much.
everyone who is listening right now, please look on your favorite podcatcher and listen to any one of her episodes on the Sim Cafe, and you will learn something.
Thank you, Devin. It's been an honor and privilege to be here with you today. Keep up the good work.
You too. See you next time. Hey, Connor, you know how objectively assessing healthcare students can be really tricky, right?
I have no idea, Devin.
Well, you want to be fair, but you also want to make sure that they're ready for a patient in the real world.
That's why VR Patients has developed an objective grading rubric. It provides error-free assessments so educators can grade with confidence and students can trust their feedback.
With VR Patients, assessment happens automatically throughout the learning journey, so educators can focus on debriefing with the student. And the best part, it's scalable for any class size from 10 to 10,000 students, ensuring standardization across the board.
See how VR Patients can become a part of your accredited tool set at vrpatients.com. That's vrpatients.com.
And if you're like Connor and you don't know what accredited means, but you do have a VR headset at home, you can try it right now for free on the MetaQuest Store or Steam.